Well, good morning to everybody once again. This is Dr. Darren Starwin. We're starting this webinar now. I just got the recording going. So whatever is said here will be recorded for future use. So anyway, this is a subject that is a very relevant one to many of the people we're seeing. And there's people here from many different types of clinical practice. I recognize most of your names. And I see people from acupuncture, aesthetics, some other medical fields. And so anyway, this is something that we're confronting more and more is people that have pain and diseases where we do the things that we're trained to do with them, but many times there's a missing element in what they need to truly recover. And we could try different prescriptions, acupuncture points, different types of therapies, but many times it comes back to the stress levels and the connection of the mind and the body. So what I want to do is offer some information from what I've been using, what I've been understanding in this webinar today, and I hope this will be of help to you. Does anybody ever feel like any of these two pictures? Does that ever look like you? I'd say there's definitely some times when I would say that. So anyone who's new on this webinar, I think there's very few. I see a few names I don't know. My name is Dr. Darren Starwin, and I've been a licensed acupuncturist for 30 years. And I'm also a developer of equipment, an inventor, a writer, and I teach extensively. And actually this webinar today is an introduction to a subject that I'll be teaching in San Francisco on the weekend of November 2nd through 4th. It's a new course that's based on psychosomatic healing. So this is a introduction to that. I have 2 more webinars that are already scheduled for the future. Now next week there will be no webinar. I'm actually going on a spiritual retreat up in Estes Park, Colorado, a Tao retreat. So I will not be able to do webinars next week. So we'll have a week off from this, and then we'll be back on November 5th with the webinar of hands-on healing transmission methods. And this is very powerful information. It's no matter what you're doing, no matter what your healing modality is, there's ways of increasing the amount of actual healing energy that comes through your hands, that comes through your presence, that really helps people on many, many levels beyond what our techniques can do. So I'm going to really talk about some of those methods and how you can learn them yourself if you'd like to. And then November 14th, we postponed what originally was next week, the webinar about energy light rejuvenation, to the week of November 14th, Dr. Terry Sherman. And there are some new ways of customizing the treatment that we'll be going over and offering tips to just keep doing it better and better and better for those of you who are either doing it or considering doing energy light rejuvenation. And there's only one more seminar this year, and it's one of our biggest ones of the year. We have a really big attendance so far, and it's going to be a great event. It's in San Francisco, California, November 2nd through 4th. It's our symposium, and we've been doing these in San Francisco for over 10 years, almost every year, maybe skipped 1 year during the last 10 or 12 years. And so it'll be a full day on Friday, November 2nd, on advanced pain treatment, sequence therapy, and protocols for how to treat many very difficult pain issues. And then the new course that I'm introducing today will be on Saturday, November 3rd, frequency medicine for psychosomatic stress-based disorders. And then Dr. Sherman will be teaching on Sunday, energy light rejuvenation. You can earn 24 CEUs, and it's a great place to be. And actually, I've set up some surprises for people there that should be a lot of fun. So if you're one of the people who are going to be there, make sure you bring your dancing shoes. So what is psychosomatic disease? This is a term that I'm sure all of us have heard, but let's look a little more closely at what it really means. Psychosomatic illnesses are those that are caused by emotional stresses or mental stresses that manifest physical diseases without what we'd call a biological cause. You know, there's no obvious toxin in the body or bacteria or virus or physical trauma that people get diseases. That's a whole class of diseases. And some of the common ones that people get that are considered psychosomatic would be many digestive issues. You know, because the brain has one of the cranial nerves that comes from the brain area is the vagus nerve, and as most of us know, the vagus nerve goes right to the stomach area, and so emotional stress and various kinds of imbalances in the brain can actually send stress signals that then cause ulcers and probably leads to irritable bowel syndrome. So definitely, medical science has known about the consciousness, the mind connection with digestive issues for a long time. That's very obvious. So people with irritable bowel syndrome, leaky gut syndrome, colitis, ulcers, many other kinds of digestive upsets frequently have, I'd say a high majority of them have to do with psychosomatic causes. Chronic pain, there's so many causes of pain, and I'd say that most of them, especially when it's chronic, there's a psychosomatic aspect. Because when people are really happy, well-adjusted, emotionally happy, and eating good diet and so on, yes, many people in that situation also have pain, and there's other reasons you can explain it, but certainly there's a lot less than people who are unhappy or people who are stressed in their life. Headaches are often a psychosomatic causation. Chronic fatigue, basically the collapse of the body's energy systems can be very connected with this. And I personally had an experience of that back in the 1980s when I had what seemed like pretty severe chronic fatigue for quite a few years. And there was no blood test, didn't really show any obvious microbes or anything like that. And I had to make some changes in my life and my lifestyle, my attitudes and so on. The chronic fatigue cleared up. So there was no real medical treatment needed. It just needed a change of how I was thinking about things. Panic attacks can often be connected with this, and even things like sexual dysfunction, infertility is often commonly thought of as very psychosomatically connected, and I think you can understand why when you understand about the chakras, which we're going to go over today. Fibromyalgia very clearly has mental and emotional causations, and there's a wonderful little book by Bob Flaws from Blue Poppy Press, where he talks about fibromyalgia and the mind-body connection and the organs, the spleen, the liver, the kidneys, and how it all interrelates with fibromyalgia, and gives some herb formulas. I highly recommend that. And then when it comes to cancer, autoimmune diseases, I know there's a lot of talk about autoimmune diseases because they're getting so prevalent. Heart disease and certainly depression, anxiety, and so many things like this are very much connected with psychosomatic disease as well. So this is really a high gamut of the kind of people that we're seeing. So how prevalent is this? Well, I found a few of these quotes I wanted to put out here. That Indian Journal of Occupational Environmental Medicine had an article where they said, moderate levels of stress are seen. This is a study of nurses in hospitals. The incidence of psychosomatic illness increases with the level of stress. So basically this was the result of a study, the conclusion of a study. So basically saying that as they've seen, as people have greater and greater stress levels, and nurses certainly have a lot of stress on them, many of the physical illnesses increase that they would have. So they did a retrospective study to look at that. Healthcare organizations need to urgently take preemptive steps to counter this. Then there was a journal from Japan, the Biopsychosocial Journal, where they said Japan has been witnessing a considerable increase in the number of children with psychosomatic disorders. And so they basically studied, it was 1,592 Japanese university students were given a questionnaire to study what their experiences were. And basically the conclusion was that 14.8% of all those college students actually had psychosomatic disease. Now these are young people. You don't think of them as people that would normally be sick, but obviously that's among college students pretty high. And it probably is actually higher than this. These are just the people who are in the study that wanted to talk about it. So how does psycho-emotional stress affect the immune system? This is really one of the links that psychoneuroimmunology has been looking at for a long time, is that three of the things physiologically that happen with stress is one thing is it increases heart rate and blood pressure. And blood pressure can lead to strokes, it can lead to heart disease, kidney disease, and so on. Also, there's stress hormones, corticosteroids, which are stimulated from when the pituitary goes into the brain's in overdrive. It affects the pituitary. Some of these corticosteroids, adrenotrophic hormone, can actually have been shown to suppress the immune system. And I've also seen evidence from Germany, from some of their research there, that it also helps to stagnate the lymphatic system. So when some of these hormones are imbalanced, the waterways of the body stop circulating well, and that leads to a whole bunch of other diseases, including cancer and many other types of issues. And then, of course, we talked about the digestive disturbance. So these three factors can lead to increased risk of disease. So this is all to show you how important it is that we help our clients and ourselves to handle stress. So here's a good question. Back pain is one of the most prevalent types of issues that we see in our clinical practice. Do emotions cause back pain? Now, John Sarno is a medical doctor who's a professor of rehabilitation medicine at New York University School of Medicine, has been very outspoken about this, and he's written quite a few books and done research studies. And his statement is that 75% of all back pain cases are primarily emotionally caused through unacknowledged emotions. This is a pretty strong statement. Now, normally you don't hear things like this from people in the medical establishment, but this is a guy who's either personally or through his colleagues seen, thousands and thousands of cases, and this is what his conclusion is. What do you think? For any of you on this call, why don't you tell me your opinion if you agree with this or if you think this is an overblown statistic. You can just click the raised hand symbol and let me know about that. So what is PNE balancing? This is a system that I have developed. The elements of it are ancient, and it's really chakra balancing work. It's been around for a long time. But what I've done is put together several elements of acupuncture and vibrational medicine to create a system which is really powerful, it really works quickly, and can help people pretty deeply with these kind of psychosomatic issues. So I would say it's an integrated system of vibrational medicine that powerfully supports patients with accelerated healing for depression, anxiety, the effects of trauma, and stress-related pain or illness. As you can see, PNE stands for psycho, neuro, endocrine. And if you look at some of the charts out of books about chakras, you'll see that each chakra in the body regulates one of the major nerve plexuses, like the solar plexus is actually a nerve plexus. Then you have your solar plexus chakra there. That has a great deal of effect over that. Then there's a certain set of organs that are regulated by each chakra. And then there's always an endocrine gland that's regulated by each chakra that puts out hormones. So these are very, very important. So they also are very associated with our mind and our emotions. Just like Chinese medicine has said each organ is in charge of one of the major emotions, the chakras are intimately connected with that and are probably a big part of why organs are connected with emotions. So the endocrine gland system affects most bodily functions, ranging from genetics to emotions to central nervous system functioning. Each PNE center is associated with a specific gland. So as I said before, PNE centers can therefore affect our moods and energy levels through hormonal, biochemical, and brain effects. A decreased flow of energy through any PNE center can cause hypoconditions of any gland, such as adrenal insufficiency or hypothyroidism. It can also promote feelings of depression, fatigue, spaciness, or weak immune function. Excess or stuck energy in one of the PNE centers or chakras can cause hyperfunctions of glands or organs, which can include intense anxiety, anxiety attacks, attention deficit, hyperactivity, mania, panic, rage attacks, road rage, and actually psychosis associated with that. So PNE balancing can be used for quite a few valuable applications. One of them is, of course, the treatment of psychosomatic disease and pain. Chronic pain treatment, again, if you believe John Sarno, that 75% of back pain at least, and maybe many other kinds of pain are psychosomatically caused, then it makes a lot of sense to go in and check and balance the chakras and to work on that level. Many kinds of diseases, even ones that, let's say, people can't even diagnose well. There's so many diseases where medical doctors basically just put people on steroids to bring down the inflammation. They don't really know exactly what it is or how to cure it, but that just at least brings down the symptoms temporarily. So that's sort of the cure-all in the medical establishment. And as we know, long-term use of steroids is very harmful to the organs. So if using PNE balancing, you can actually get to the root of many of these issues and really help support people so that they won't need to go down that route. Autoimmune diseases, again, there's so much interest. So many people ask me about, how to treat them. And I really believe this is a real key, that if you look at people with autoimmune diseases, they always have these very odd spin patterns in their chakras. And by using the method that I'm going to talk about today, you can bring those chakras into the correct spin pattern and it basically supports more normal functioning of the body. So the body has less reason to attack itself. Now, there's a lot of other things that go into it in terms of finding out what kind of belief systems they have, what sort of unexpressed trauma that there may be stored in their body, and other types of genetic issues. But this is a really big key way to treat people. The psyche, the emotions. If you're working with people with any kind of addictions, this is also going to be very, very helpful, and it'll make the brain work better. Now, the brain is directly in relation to the kidneys, according to Chinese medicine. And one of the major energy centers in our body, which is called in Taoist practice the Snow Mountain area, is actually where the brain gets its energy from. And it's in the lower back. So basically the location of the Snow Mountain area would be if you draw an imaginary line from your belly button straight back to your spine, which is approximately like the Ming Men area, which is between lumbar 2 and lumbar 3. Then you go down about 3 to 4 sun, which is about the width of your hand. The Snow Mountain area would be right in front of the spine. So it's kind of in front of the upper part of the sacrum and the lower part of the lumbar area. And basically, the strength of that energy center is what will allow the brain to work well. So when people have Alzheimer's or memory fog or poor memory and brain fog and all these kind of things, definitely you can count on the fact that that Snow Mountain area, which is very associated with the second chakra and the first chakra, is very deficient and doesn't have much charge. So what is at the root? I mean, people come into our offices with all these complaints, but what's at the root of them? And really, from my study and my experience, I'd say it's the big three. Our favorite experiences on planet Earth, how we seem to just want to create more and more and more: shock, trauma, and abandonment. These are the things that seem to be what the world is full of. And so basically what happens is we're very sensitive beings. And I actually personally believe we've had many, many lifetimes, and in each lifetime we've experienced various types of shock, trauma, and abandonment, and very little of it was totally healed and resolved. So some of it just gets stored in our energy bodies, and it gets stored in our bones, our fascia, and nervous tissue. So all these areas can hold memory in its own way, and water can hold memory. And our body's 80% water, as I'm sure you've heard. And you've seen Dr. Emoto's photographs, no doubt, showing that water can hold images of consciousness and different positive and negative experiences. So basically, these energies of shock, trauma, and abandonment become coded into our body. So a lot of times they'll be more in abatement, where people can live a normal life and it seems sort of in the background, just sort of the general low-level neurotic stress level that everybody lives with. But then when somebody feels threatened or stressed, it can act as a trigger to bring these things to the surface. The brain has an area called the amygdala, which is kind of like the button push for bringing old stressful patterns up to the surface. And so when that happens, there's a whole set of stress responses in the body. It's often called the pituitary adrenal axis that gets activated. And if that gets activated a lot, people start saying, I'm getting burned out and drained and all these kinds of things. So PNE balancing can also bring up these issues so that you can resolve them. So when you work on the chakras with the color light and with some of the things that we do, the person can actually make shifts inside themselves to see it in a different way, to forgive these issues, to release them, to transform them. There's various words we'd use, but basically people do get better. Here's a little picture of where the amygdala is. So how does PNE balancing work? This is kind of what it looks like. You can see there's positive probe is put on the front of the body, in the front of a chakra. Negative probe is put on the back. So I find it's very important to have that polarity to make it work properly. And the color light is essential. That means you need to choose a color, which is what that particular chakra in there is needing. The best way to do that is through muscle testing, because as much as you can study the colors, it's many times it's paradoxical what color they actually end up needing. So it's really worth developing your skills for that. Let's see if there's a couple of comments that have come in here. Jade has said, my husband and I have witnessed positive results following Dr. Sarno's book on healing back pain. My husband fixed his back pain this way and has not come back. Well, good. Well, thank you for that testimonial about Dr. Sarno, Jade. That's very good. So yeah, I definitely would recommend his book to learn what he's talking about. So anyway, there's three main aspects of how we do PNE balancing. The first one is color, light, and microcurrent, which is what we call microlight therapy, is applied directly to the imbalanced chakras. So again, the positives on the front, the negatives on the back, and you have a color light filter put in there, so you have the appropriate color that that part of the body is hungering for or needing for balance. I also recommend the use of essential oils. There's one real great contribution in one of our past seminars is Victoria Bender came and taught with me, and she's a real maven of essential oils. She actually contributed to my new book that I'm finishing up now about PNE balancing, about essential oils. And she came up with a set of 7 or 8 essential oils, like one top one for each chakra. Now, of course, there's many oils that you could use for the different chakras, but what this is ones that are just really reliable that come up over and over again. And so what we often do is we muscle test the chakra to make sure that that's actually the oil it needs. And again, you can confirm that just like you do with the color. And then apply a diluted a blend of that oil onto the front and back of the chakra. So you'd actually dilute it down to about a 1 or 2% solution in a carrier. You rub a little bit here, and then you apply your probes. Then I give people that little bottle of oil to take home and smell and put on their body in between treatments, and it's wonderful. So really what they're getting here is they're getting microcurrent, light, and essential oils, and then guided in toning. Toning is making sounds or tones that actually vibrate the chakra and bring it back into coherence. And I find that my patients like it. I do it with them so they don't feel self-conscious, and they enjoy it. So getting a lot of things happening all at one time with PNE balancing. Now also, 2 adjunctive things would be acupuncture. There's quite a few acupuncture points on the body that have strong psycho-emotional effects. And where I learned about most of these, first was Professor J.R. Worsley, who is the founder of the 5-element acupuncture system. He has written out some compendiums of the effects of the points, and he focuses on those psycho-emotional indications much more than they do in China, where they're more cut and dried about them being more physical and effects. And then also, other people have taken that work and carried it on and done more with it as well. I really recommend Lonnie Jarrett's book, which is the clinical practice of Chinese medicine, where he's taken a lot of Worsley's indications and added a lot of his own, so you can learn about these acupuncture points. And I'm going to teach some of these at the San Francisco seminar, so the ones that I think are some of the most important ones. So basically, you can actually put needles into some of these distal points. And what's even better is microcurrent. There's a special technique for this, where you choose probe preset number 1 on your microcurrent device. That's what it would be called on the Accutron. What that does, it creates a biphasic back and forth polarity. And then let's say if you're choosing a point, like for instance pericardium 5, that point has an indication because its pericardium has to do with love, intimacy, sexuality, intimate relationships. It's the heart protector. That point has an indication for helping people who have been traumatized by the painful breakup of relationships. So that's one of the psycho-emotional indications for pericardium 5. So you could actually put one probe on the left pericardium 5 and the other probe on the right pericardium 5, right arm and left arm. And of course, you have to make tests for the correct color, and then you put them in place and then treat for, say, like a minute or 2. What's happening is the microcurrent is polarizing back and forth. So actually, the pathway of the current is going up the arm, somewhere through the head and neck area, and then down the other arm. And by going back and forth like that, it has some kind of subtle effect on the brain, which has some similarity to what's called EMDR, where people are switching their eyes back and forth, rapid eye movement. This is not, of course, the rapid eye movement, but it's a similar thing of a back and forth energy going through the brain, of course, through those acupuncture points. That we found that to be very, very effective to do that with PNE balancing. And then another essential part would be intentional and healing statements on the part of both the practitioner and the patient. So the way I do that is when I'm starting with the patient, I silently and within myself make an intentional statement about my intention to do the best job I can to allow the healing treasures and flows that help me to work through me, and also my own boundaries are secure and I take nothing on from that person. So I just always make that little speech to myself and whenever I remember to. And then many times I will guide the patient in making their own intentional statement, because I find that when they make a statement of intention before the treatment, it lines up a lot of things inside of them to respond better to what I do. So these are the three most important parts of PNE balancing. Now you can also consider other things that can really help this psychosomatic treatment. One of them is, again, Professor Worsley gave some great treatments, and one of them is internal and external dragon treatment. And you can get that from some of 5-element acupuncture books and so on. And that's a series of points that are done when there's some sense of the energy of possession in the body. Now, possession is a huge factor when you're dealing with trauma and you're dealing with psychosomatic issues. Now, the classic possession is like the movie The Exorcist, where a little girl was possessed by the devil and her head spun around, and the priest had to come in and do an exorcism. I mean, that's like the classic issue, but lots of people have less dramatic forms of possession. Now, possession could be like unhealed relationships, where they're not with a person, but they're still possessed in a sense by that person's personality or that person's energy, or cords that they have to that person that have never been severed. Many people like PTSD, many veterans have come that are dealing with PTSD and so on, have definitely a lot of issues with possession and you don't have to necessarily think of it as an evil spirit or something, but you think of it as possession by traumatic emotions, which are running a lot of their circuitry inside. So anyway, that's a really good thing to study that. And again, in that book, The Clinical Practice of Chinese Medicine by Lonnie Jarrett, he gives very detailed instructions how to do the internal and external dragon treatment, and also the aggressive energy drain treatment, which is another one of Worsley's treatments. These are three treatments. They're needle acupuncture treatments that can be extremely valuable for people with trauma. And if you're not using them, I'd highly recommend that. Also, the battlefield acupuncture protocol from Dr. Richard Niemsau can be very helpful. Auricular therapy. There's actually a whole series of points in the ears which have been proven to have strong psychological and psychic effects. And again, I'm going to be teaching those at the San Francisco seminar as well. I'm all prepared for the handouts. And if you look in Terry Olison's book, the Auricular Therapy Manual, you can find a lot of these. A lot of them are right in there. Now, there's a wonderful system of herbal medicine called body space medicine. And I really recommend, if you're into Chinese herbs, that you buy this book. You can go to Amazon.com and just look for body space medicine. The author's last name is Guo, G-U-O. And it's a very spiritual system of Chinese herbal medicine where he uses very few herbs and low doses of herbs. And he uses the herbs primarily to clear the energy spaces in the body rather than addressing symptoms like the way most Chinese herbal formulas work. And this Master Guo, he passed away a little over a year ago, but he still has this clinic running that his family is still running in China, where lots of people who are given up on by the medical establishment with terminal cancer go to it's a residential clinic, and there's a very high cure rate there of these people that were given up as hopeless. And they're using this body space medicine. It's the herbs plus a lot of other soul healing practices and various types of therapies that they do there. Of course, they can't call it soul healing in China. They have to use other words for it, but that's what it is. And soul healing is something that I practice and that I'm certified in, and actually anybody can learn it. And my webinar that's going to be on November 5th, I'll be talking a lot about this subject, so I'm not going to take any time about it today, about what this is and how anybody can really apply it. It's not a religious thing. It's really a medical modality. So these are the kind of treatments that I have found the most valuable dealing with these psychosomatic issues. Let's take a look at it in detail a little more. So there's two ways to use PNE balancing. In the early days when I used to do it, when I was developing, I've been really doing it, various versions on this for 10, 15 years, is I usually end up spending like an hour, hour and a half, sometimes 2 hours with people, going deep into all their feelings and talking and processing and regressing them to past lifetimes and using all these same tools I'm talking about. But I found that a lot of that was really unnecessary, that the actual effects of the PNE balancing take place very, very quickly. Now, people integrating it takes a long time. But what I'm doing more now is 10 to 15 minutes. I can do a PNE balancing. So that means I can still do an acupuncture session with somebody and add PNE balancing in and still get it done within the time frame I need to do. So that's mainly what I'm focusing on now. But there are some patients that are deeply traumatized, that have been through abuse or rape or whatever it is, where it's really worth it to spend an hour with them. Of course, you have to just adjust your schedule and spend more time. And it's really not because the peony balancing needs that amount of time. It's mainly just to support the patient. Okay, there's it's funny, when I first read Jade's note here, it said something like, my husband used Dr. Sarno's book, and since then he's never come back. And I thought, his husband didn't come back? Oh, no, the pain never came back. I thought, okay, that was a lot better. No, but anyway, somebody said, can you write his name? Now, I wonder who's, I guess I'm not sure whose name you're talking about. So let's see, this person here. Okay, Odelia, please just tell me whose name you want me to write, because as I move down through this webinar, I forget who I said before. If you're talking about Guo, it's G-U-O, if that's the one you're looking for. The professor of 5-element acupuncture. Okay, that one I can write. Okay, well, what I'll do is I will take a moment here to write that name for you. So, J.R. Worsley was the founder of 5-element. Lonnie Jarrett wrote the book, The Clinical Practice of Chinese Medicine. And it's Dr. Guo, who wrote the book, Body, Space, Medicine. There. So those are some of the names I just said. Debbie asks, how soon can we purchase your new book? Well, as soon as I get it published. I am so busy. It's very hard to write a book while you're actually doing as much as I am. But it's actually all written, and I'm very grateful to John Ross from New Mexico, because he's been helping me with editing, and he just agreed to write a foreword for it. So I am much kudos to Dr. John Ross, because he is helping me with this. And hopefully with his help, getting the foreword written. The other person who was going to write the foreword just had some health issues, so had to bow out from doing it. But anyway, it is pretty imminent. I'd say my goal is by the beginning of the new year that it'll be available for purchase. Anne asked, is the pericardium 5 is the point I talked about, not pericardium 6. I believe it's called Jian Qi in Chinese. Okay, so how do you actually test with peony balancing? There's really 3 ways to test the chakras. One of the ways is you can develop sensitivity in your hands, where you can just basically scan your hands up, down, the front or back of the body and feel them. And I used to feel pretty insensitive, and now I can do it. So if I can do it, anyone can do it. So basically, it's just one of these things that the more you put attention toward your sensitivity of different parts of your body, you can develop it. I mean, it's often said that people that lose their sight develop much more hearing and touch sensitivity. And as a result of that, there's a big amount of blind people who are acupuncturists in Japan, because they've developed so much sensitivity with their touch that actually people like to go to them because they're such great acupuncturists. So you can develop more sensitivity in your hands and in your intuition if you just start doing more PNE balancing. That's one way. Dowsing with a pendulum is the best way to test the chakras, because your hands, you can feel general feelings, and with muscle testing, it's either yes or no. It's either strong or weak. But with the pendulum, you can actually see various spin patterns, which I'm going to show you here, which give you a lot more information, much more detailed information. So I actually recommend learning all 3 of these methods, mastering all 3 of these methods, because each one of these things, like dowsing and muscle testing, they're both forms of dowsing. Some people, they do it very easily. Other people have like a mental block, and they doubt their results, and they feel like they can't get it. And there's a reason for that. That means there's a little bit of blockage in your own chakras somewhere. Maybe some past association, some past negative association that you have from God knows where, that makes you distrust energy, feelings, or doubt yourself, or whatever it is. So whatever it is, I know you can get through it. You just keep practicing these things and put your intention toward it. You'll break through that and be able to do these types of tests effectively. Just like anything else, practice makes perfect. So here's some of the most, I'm not putting all the spin patterns possible in this webinar, but I'll give you some of the most important ones, is that when you put a pendulum, or somebody lays on their back and you take a pendulum, it's Usually about a 6-inch string is about right, and then a weight at the end. It doesn't have to be any particular fancy thing. I mean, I have a little gem at the end of mine, but at our seminars we use what's called Ace Hardware pendulums, where we buy nuts from Ace Hardware or Home Depot and put them on the end of a piece of string. They work perfectly well. So anyway, you hold that over the chakra and you just watch it. And what will happen is if it starts going into a clockwise circle like this, it's clockwise as you're looking down on the body. It would be clockwise to you. That means the center is basically healthy, open, and in harmony. Balance between the male and female poles. This is another big thing that you'll see a lot as you work with people with psychosomatic issues, is there's often male-female imbalances, and not necessarily in gender identity, or of course that's very possible, but also just in their body sense. The left side of the body is more feminine, the right side is more masculine of the body, and it's opposite in the head. And so a lot of times you'll see spin patterns of the chakras that show male-female imbalances, and those bring up issues that need to be resolved. When you see a very small circle, it means that there's a low amount of energy. It means it's basically healthy, but there's not that much energy in it. When you see a really big circle, it means that there's a lot more energy in it. And sometimes the pendulum doesn't move at all. Now that could be because you're just starting to learn it and maybe you're a little awkward with how you hold it. But once you learn how to do this kind of pendulum dowsing, if it just stands still or barely moves at all, the body has shut down that particular chakra pretty extensively, and that can lead to serious disease, so that really needs to be addressed. Sometimes it'll go in a counterclockwise circle, and that could be normal for a woman who's having a menstrual period or someone who's going through a huge detox process. That might be the body just unwinding some stuff. But usually it's not a very positive sign. It usually means that the person at that level of what that chakra represents, like which emotion or gland it represents, is closed to exchanging energy. They're denying the emotions or the feelings of their body. And often these are people that do what we call projecting. I know my daughter and I have joked around a lot that some of the boyfriends she's had, whenever they get mad, they'll say, "You always do that." Like let's say if she does something that annoys them, or they'll always start words with, "You always do that," or "You never do this." So we always joke about it. As soon as someone starts saying "you always" or "you never," you know that they're projecting. And you probably, if you looked at their chakras, you'd see these counterclockwise spins or something like that. Now, this is the biggest closure when you see the pendulum just going left and right, back and forth like this. Again, as you're looking down the body, it would be horizontal to the body. That's the strongest form of blockage, and it just means that it's even stronger than a counterclockwise circle. It means that that person is just refusing to acknowledge or feel the truth or emotion associated with that PNE center. They have some fear about it, some judgment, or some trauma associated with that part of their psyche or that part of their body. And so when you see these, you know that you really need to clear these up in order to help that person. And if you look at people with autoimmune disease and psychosomatic issues, you'll see this frequently. Another common one we call cloverleaf. It's where the pendulum spins in an elliptical pattern, and the ellipse keeps changing direction. And you could just you could hold that pendulum over that chakra for 10 minutes. It'll just keep doing it. I mean, it's very self-perpetuating. And the way that we interpret that is that there's some major change happening in that part of the person's body and psyche. And usually it could be a change for the better. I mean, a lot of times when I give somebody a really powerful PNE balancing session, it'll go from, say, like a lot of times, let's say, for instance, it may start with a spin that looks like this, back and forth. And then after I do the PNE balancing, it looks like this. And what that means is that that area is now in a transformative process. Like that, their mind, their beliefs, their emotions associated with that part of themselves, they're now reconsidering, renegotiating within themselves, like considering a new way to see things or problem-solving mode. So it's a transitional thing. Now, also, it could be that the person's just indecisive and confused. They're pulled between two different things. They can't make up their mind, and it's really draining them. You could see a cloverleaf also. So you have to kind of know the context of what's going on with that person to know what the cloverleaf really means. So let's go through some of the steps of PNE balancing so you can learn a little more about this. And I haven't put everything in here because just for a webinar I can't go into detail. This will be an 8-hour course I'll be teaching in San Francisco. And then the book is something like 280 pages or something like that, so there's a lot to it. But these are the most important steps. The first thing, of course, is you always do your intake. You want to learn whatever you can about the person, their complaints, their health history, what your impressions of them are, what you feel about them, look at their body language, all those kind of things. And then you also, if you're an acupuncturist or whatever your profession is, you want to do your own diagnosis of the body and the organs and so on, so you know the person's health picture. Of course, what their health history is. I like to start the session by guiding them in creating a highly resonant intentional statement. It is my intention to connect with the root of my migraine headaches and transform this energy into good health. Or it's my intention to move out of dysfunctional beliefs about myself and relieve my back pain. Whatever it is, you have to come up with something where they are taking charge of their intentional power. Like when someone says something like, I wish that this would go away, or I hope this would go, that's not an intentional statement. When you say it is my intention too, you're tapping into a much, much bigger energy field that Wayne Dyer and Carlos Castaneda and many people that have written about it say is really a universal field of power when you create an intentional statement. So it's worth taking the time to guide your patient in doing that and write it down and give it to them as homework to do in between sessions. Then you test the PNE centers with chakras or muscle testing, look at the spin patterns. And I always look at the correlations between what I see in the chakras and what I know from the medical diagnosis I did of the organs and conditions and health history. And then you choose one or two PNE centers to treat. It's really almost very rare you'd ever want to treat more than one or two in a session. And then there's what's called color challenge testing. And the way that is done is that once you find, let's say, an imbalanced PNE center that has a back and forth blocked looking pattern, you have the person put their index finger on that center. You do a O-ring test, muscle test with the other hand, and it'll always go weak because whenever a person touches a dysfunctional point on their body, it makes the muscle test go weak. Then you put various color filters, and if you have an Accutron unit, that comes with color filters that you can use for that purpose, under their finger or right next to their finger in that area, and you keep muscle testing. And when you find the right color, an amazing thing happens. If their hand turns into iron, it's not just, there's usually several colors that will make the hand somewhat stronger, the muscle test stronger, but there's only one that will turn it into iron, where it doesn't matter if the person is muscularly much less strong than you. It's very hard to budge those fingers once that right color is there. There's something, that alone is such proof of how powerful the energy fields of the body are. So that's the color then that the color hunger exists for in that chakra, and that's the one you want to use there. And then you can also do the same thing with essential oils. If you have little bottles of oil, you can also challenge test those. Now, how you actually treat people is people need to either stand up or sit up because you need to get to the front and back of them. Now, sometimes if someone's really sick, they can lay on their side, and you could do the front and the back that way. But if possible, I prefer them to stand up or sit up. It also helps the energy to move up and down the spine as you clear it. And then you do the treatment I talked about, where the positive probe is on the front and the negative probe is on the back with the correct color. You apply the oils, and you also have them do toning. So you guide the patient in toning the sound that corresponds to that chakra or center that you are treating. And usually each chakra I'm spending about 1 or 2 minutes with them on doing the toning and the microcurrent and the light and so on. Now with the heart chakra, we do not use microcurrent, use light only. Even though the currents are so low that it's almost impossible that it would really harm the heart, just to be on the safe side, we don't recommend passing any current through the chest. So you just hold the probes there, put the light on, but don't press the button to actually activate microcurrent. So if you're doing a second chakra that's higher, you start with the chakra that's lower in the body, and then you move up. It's the best way to do this. And then after you finish that more active part of the treatment, you ask the patient to lie down and totally relax. Usually they lay down on their back. You try to dim the lights in the room. It's nice to have some very soft, relaxing music there, and to have their aromatherapy on their body. Now, if you're going to do acupuncture points, I talked to you about those psycho-emotional acupuncture points. This would be a good time to either insert your needles or take your microlight probes to do that bilateral stimulation. If you're going to do needles, do very superficial stimulation for this type of technique, like Japanese style. Don't do deep insertions for PNE balancing. And now there's also, if you want to use auricular points or put auricular seeds in or something, you could do that also. Now, what Victoria has taught me, this is what she's contributed to the peony balancing process, is at this stage, this is the more yin stage. So when you're actually having them, they're toning, they're sitting up, you're applying the current, that's the more yang or active stage of peony balancing. When they lay down, you dim the light, you start doing some gentle reflexology on their feet. What it tends to do is help them unwind. Like whatever has been stimulated from what you did in the first part of it starts releasing and integrating and unwinding during this part of it. So we call it reflexology and unwinding. And this is a good time to, sometimes they just may want to be silent. Sometimes they might need to cry a little bit. Sometimes they really want to talk. And this is where you have to develop your counseling skills to know how to draw people out, help them to discover things for themselves. As a practitioner, you will frequently get intuitions and images or understandings about the person at this stage, and you have to use your wisdom about whether it's appropriate to share that with the person or help them just to discover it on their own. This is where the biggest healing takes place, is during this stage. And here are the tones for each center. And you can see the ones that come from the Sanskrit seed sounds, Lam for the root chakra, Vam for the second, and so on. It moves up like that. So I just basically do those with the patient. Now these are ones that they're more Chinese seed sounds for the chakras. And Dr. Zhigang Shah, my soul healing master, has taught me these ones. And these are used, when he talks about chakras, he calls them the soul houses, because the kind of, when you're doing these type of mantra work, you're dealing more with the soul or spiritual level of the chakra rather than just the physiological level of it. So anyway, these are wonderful too. So the conclusion of peony balancing is that after you've done all these steps, you always want to retest the peony centers with your pendulum and see what the changes are. And it's very interesting to see this. And of course, you want to note these in their chart, is because you'll often see that there is a lot of them that were previously blocked are now circles. A lot of them will be in clover leaf because they're now in transformation. And you may find some where there's no change at all. And what you often see, and that just means that's an area where the person's going to need a lot more time. They're going to need more sessions. They're going to need more homework they can do. And this is where you debrief and you put closure onto it, give them a chance. Of course, this is where time issues come up. I mean, people sometimes would love to sit and talk to you for a half hour, but you have to be aware of your own professional boundaries. And just know that the main work is done very quickly with the peony balancing. All the talking is comforting and nice, but that's not actually what does the biggest healing. So, if they want to pay you for an extra half hour for counseling time, then you can put that in your menu of services. But the main thing is, just 2 or 3 minutes of debriefing is usually all you need. And then if you're going to do herbs, you could prescribe them also. That can be very helpful. And again, for this particular type of application, I recommend the book Body Space Medicine. It's just fantastic for, as an adjunct to this. Now, I think homework is very important. We have to think of a better word than homework. But anyway, for want of a better word, I'll use that term, because it's not just what happens in the session that helps the person with their psychosomatic issues and stress levels. It's what they do every day. So, I do spiritual practices every day. I mean, I find that I just can't get through a day without them. I mean, I've gotten to the point where it's just, to me, it's the same like eating or brushing my teeth or sleeping or going to the bathroom. I just have to do it to keep myself maintained. In fact, one of my favorite statements is, I am a very high maintenance person, but I do my own maintenance. That's kind of how I see it, my spiritual path. I have to do my maintenance every day, my meditation, my chanting, some of the other things I do, trying to offer service to people. These are all important. These are what makes the world go round. But anyway, you got to give them something to do that'll help them in their practical everyday life live out the change that's happened in that chakra. And again, that's a little too involved to really explain in this short webinar. I'll just give you like an example, though. Like, let's say there's quite a few women I've treated with peony balancing that have a feeling of like they've just kind of gotten wrung out or burned out, and they're not that much in touch with the juicy beauty of their femininity. They're more become like a work machine or a functional machine, or maybe they felt traumatized by a broken relationship or whatever. It divorces, cancer patients I work with like that. So often the homework I'll give them is that you need to gather around some of your girlfriends and do like a goddess honoring ceremony for yourself. And I make them promise that they'll do it. And I give them suggestions like put beautiful clothes on, have them put rose petals on you and massage you with oils and drink, really nice drinks and, dance with, kirtan or whatever it is that people can do to feel like they're honoring their feminine. And a lot of times women will actually do that. They just, oh, I never thought to do that. There's some people, their homework has to be to go out in nature and spend more time out in nature to get grounded to Mother Nature. There's a lot of different things, but whatever it is, and one of the most basic forms of homework is journaling, and getting people to actually write down their thoughts and experiences and dreams, which is sometimes like pulling teeth, but I just keep, encouraging them. It really helps a lot. So let's talk last few minutes here, just a little bit about colors and the PNE centers. Again, if anybody that posts a note on Facebook on my fan page will get a copy of all these notes so that you can refer to them. Everybody will get a recording whether you post on Facebook, but that's the price you have to pay to actually get a copy of my PDF notes. Anyway, here you can see that for the root chakra, it tells you what it is, and then you can see some of the colors that in my practice have frequently come up for balancing these centers. The second center, sacral, second chakra, often associated with depression, low sex drive, creative blocks, deep emotional issues, inner child conflicts. Blue and magenta frequently come up. And then when people have that kind of burnout, increasing sexual energy or adrenal function, scarlet is wonderful. Anybody that just graduated from acupuncture school definitely needs a lot of scarlet on their second chakra, or any type of professional school. They're usually drained by that time. Solar plexus center, violet is one of the most common ones that comes up. People that have too much obsessive compulsive disorder and overly mental and driving too much with their will center, violet is wonderful there. And then green or magenta for balancing emotional energies. And then here's some more. I'm not going to read the whole chart, but basically you can see that these are not the only colors you can use for these. These are just the ones that most commonly come up in my practice. Let me just see if there's any questions here. John is saying, let's call it home play instead of homework. Okay, well, yes, I'm going to give you your home play for the week. That actually sounds better, I think. Good idea. Fernando said, where'd you get the Sanskrit sounds for the chakras? That's a good question. I believe I got them from quite a few. I've read just about everything I can get my hands on in the English language about chakras, and I've just seen them in several books. They're commonly used in various spiritual practices in Ayurvedic medicine and in India. And I've been to India a few times, so I can't actually tell you where I got them, but they're so common that I know that they must be in a bunch of books that are, because I mean many different classes I've been to, they all use those same tones. So they're nothing that I made up. So maybe a good thing to do is just go and Google it. Go to Google and just put in Lam, Ram, Vam, and you'll probably get some good sources for it. Maxine said reinforcement of the session. Dara said, instead of homework, I like follow-up care. Okay, Dara, that sounds a little better. And Kathy was saying, what was the book Jade recommended? Oh, she was recommending a book by Dr. Sarno. I don't actually know the name. Jade, if you're still on and you can give me the exact name of that book, I will tell Kathy what that is. But it's by John Sarno, S-A-R-N-O, about treating your own back. And if Jade will let me know, I'll tell you the exact title. So here's a picture of the microlight probe that I have developed. That is just a marvel. It is just perfect for this type of treatment, and it's also wonderful. Okay, the name of that book by John Sarno is Healing Back Pain by John Sarno, MD. Thank you, Jade. I mean, this is for pain management. This is wonderful. It's the same thing we use for facial rejuvenation, and it greatly increases the results for that. And then for this type of PNE balancing, it's perfect because the microcurrent and light are both very helpful for treating these kind of chakric issues. Here you can see the control box that goes with the color light probe system. And here's a picture of the Accutron itself. And This is a different style of color probe that we used to make. And you can see the color filters, has all the pads for treating all over the body. Inside the mouth probe, these are used for body sculpting and facial rejuvenation, so it's a very complete system. And if you don't have one, you should run out today and buy one. Buy two, buy three. So here's a few more things about PNE balancing. As I mentioned, during that last stage of the treatment, many people go through a releasing process. Oh, by the way, I forgot to say, for those of you who can't make it to San Francisco, who really want to learn this PNE balancing, I will be doing a seminar in Sedona, and I need to finalize the date. I originally was going to do it in December, but then I came up with a conflict for all the dates in December, so I have to push it back, and I haven't actually confirmed it. But it'll be in a retreat center up in Sedona. It'll be 3 days of just totally getting into this type of work. And you know, there's a lot of it is the actual intellectual skills, and then a lot of it is just developing your own consciousness, your own sensitivity, opening up your own soul healing channels, and so on. So we're going to have a wonderful time. We'll get out and do some hiking out there on the power vortexes. So just keep watching the East-West Seminar site, and hopefully we'll get that confirmed very quickly for the date for that one. I'm hoping to do it before I go out of town this weekend. So just want to let you know that's another chance to study with me and really learn this PNE balancing in depth. So anyway, one of the things that happens when you're in that final stage of the treatment where they're laying down, you're doing the foot reflexology or the acupuncture, is that they start releasing. Now, I hardly ever get people with huge, dramatic, emotional releases. I don't know, I just don't tend to attract people, I guess, like that. But frequently, people will cry a few tears, or they'll laugh a little bit, or memories will come up, or look at images, or whatever it is. It's part of the whole process of unwinding. And you may get somebody who's really has a lot of pent-up, emotion, and they'll cry deeply, and you just have to be prepared for that. But anyway, the unwinding is something that's been recognized by John Barnes, myofascial release and other systems, that it's something that happens when good energetic therapy happens. The body has a natural way to unwind that energy out. And whether it's actually going out or transforming, unwinding is actually a chakric thing, because the chakras work through spiral energy patterns. So it's really kind of unwinding a lot of this tense energy, and energy is neither created nor destroyed. So I don't think you actually release the energy. I think you really just redirect the energy. But anyway, it's really important to guide people through breath work and helping them through that, make sure they have plenty of water in their body, and also just really coaching them to change some of their languaging and to help them see things in a new way. And this is really beautiful what you see happens with these sessions. Another thing I'll mention is that everybody is not ready to have work done right on their PNE centers. Some people who have a lot of repressed and unresolved issues and anger and so on, it may be a little too strong for them to go right on their PNE the first time you see them and start doing PNE balancing. So there's various indirect ways that you can work. And so you need to check with the client's higher self. And how do you do that? You just ask and just listen within yourself, and you'll get a pretty good feeling of yes or no. There's also, ways of dousing yourself, like body pendulum and things like that I teach in my seminars. So just you have to have some way that you can get your own yes or no answers. And so just check. And if your intuition says that you feel a little shaky about going into this very deep level of therapy with them right away, then respect that. And things like just regular good acupuncture sessions, or massage, or acupressure, or just working with the essential oils. There's many other ways you can ease somebody into this, and maybe after 2 or 3 sessions of that, they'll be ready for PNE balancing. So anyway, if there's anyone on this webinar that's new to microlight therapy and is not yet using it and wants to learn more about it, here's what you can do. You go to www.eastwestseminars.com/getinfo. Or you can just go to the home page of East-West Seminars and look for the link at the top that says Request Information. Either one of those will open up a form where you can then request whatever information you want about this. And we have a whole lot of videos we can send you about this, where you can learn more about microlight therapy. There's literature that we can send you in the mail. You can be invited to future webinars and seminars. So that's where you go for that. I think most people here are already opted in, but this is if you're new. I also have a forum that's for people that own the Accutron and want to communicate with their colleagues. And if you're not a member of that, you can just write to me at dstarwin@eastwestmed.com, and I will send you an invitation link for that. And if you want to get a copy of the slides, the PDF for today's webinar, then post a comment on my fan page at www.facebook.com/Microlight Institute. And Jen will send you today's PDF. And again, here's that seminar coming up. So I am going to just see if there's any final questions or comments before we close here today. Okay, Jade said he also has, Dr. Sarno also has a book, The Mind-Body Prescription, Healing the Body, Healing the Pain, which he recommends. So again, another book, Mind-Body Prescription. Jade is saying a lot of what you are talking about today is what I have been doing for almost 2 decades as a Reiki master teacher. Okay, well, I guess, Jade, it'd be interesting to see whether adding PNE balancing can enhance that, because I do soul healing work, which is, and divine healing hands, which is something similar to Reiki in the sense that they're energy transmissions through the hands. And what I found is that that is a wonderful adjunct with doing this more energy vibrational approach to the body with color light and microcurrent and oil. So I'd really encourage you to experiment with combining those together and see how much more that may help some of your clients. And please keep in touch with me. I'd love to talk to you about it if you to see how that's working for you. I'd also really encourage you to post some comments about your Reiki experiences in the forum so you can get some discussions going about that. Dara said, thank you for providing this very valuable seminar. You're most welcome. Fernando said, how accurate is pendulum diagnosis for conventional diagnosis of chronic disease? Well, pendulum diagnosis is very, very accurate once you learn how to do it. You just have to basically learn a sense of detachment where you just look at it with detached curiosity. And the reason I know that pendulum diagnosis is so real is because so many times I think I know what the pattern's going to be, and I put my pendulum there and I get some totally different thing, and I go, what the heck is this? Where's this? So I know if it's not fulfilling my expectations, hardly ever. It's usually showing me things that then puzzle me, and I have to really figure out why it's. So once you learn the art of interpreting it, so if you're asking conventional diagnosis, like can you diagnose emphysema or basal cell carcinoma? No, I don't know what, I mean, you could use a pendulum, let's say, to ask various yes or no questions. But what I find is by diagnosing or evaluating what's going on with the chakras or PNE centers, you can extrapolate to that to give you ideas about conventional diseases. So I'd say the answer is sort of yes and no, Fernando. It's not the same as like doing blood work. But if you see a deep blockage in the solar plexus and somebody's having irritable bowel syndrome, it certainly shows you a lot of why they're having that. And Jade said, I cannot wait to ask microcurrent and microlight to her work. Okay, well, thank you very much. So thank you all for coming on here. Again, there's no webinar next week. So you'll just have to build up that deep longing for my webinars for 2 more weeks, and then I'll be back with the next one. And that one will be about hands-on healing. So that'll be something, it's not Reiki, but it's a system that's just similar to Reiki, that they each have their just different systems for accomplishing a similar goal. And I'll be talking about that then. And so have a wonderful rest of your week, everybody. And if anybody on this webinar is going to be in San Francisco, then I look forward to seeing you there. And please consider, if you're interested in the subject, to come to Sedona early next year. Okay, take care. Bye, everybody.